My name is Toney, Senior. I am the Mayor of the City of Benson. Today is update for March 26, 2020. Today, joining me from the Benson Hospital is CEO Julia Strange and also Dr. Barbara Hartley, Chief of Staff at Benson Hospital.
Everyone, I'm Julia Strange. I'm the CEO at Benson Hospital. And in a little bit, you're going to hear from Dr. Hartley, who is our Chief of Staff. I want the community to know that Benson Hospital is here for you. We were here for you yesterday, we're here today, and we will be here for you in the future. Our dedicated staff is working tirelessly to make sure that the community has the care that they need. I want to give you just a few updates about what's happening at the hospital because of the COVID-19 pandemic. We have been making some operational changes that we've been trying to communicate to keep our staff and our patients safe. We've instituted a policy for no visitors. That's both in the inpatient unit and in our emergency department. Children are able to have one visitor with them in the emergency department, but other than that, we are not allowing visitors. We are working with people to allow visitation through Skype and other social media transactions, and so it's important to keep those connections without having that physical presence. If you come to the hospital, you'll see that outside we are doing temperature checks for all outpatients and for staff. That is important for us to understand whether or not someone has a fever of more than 100 degrees. If so, they will not be, staff would be sent home, and that individual visitor would be referred to the emergency department. We are asking, if you've got people that are getting services at the hospital, we're asking their loved ones to wait in the car rather than in our lobbies as well. Benson Hospital is in regular communication with our partners at the city, at the county, at the state, and the federal level, so that we can best understand how we can continue to prepare and make sure our community stays safe. We are very grateful for our colleagues at TMC Healthcare who are helping us navigate these difficult and changing times. Dr. Barbara Hartley, our Chief of Staff, to talk a little bit more from the medical side and the medical perspective of our preparedness.
Everybody, I'm Dr. Hartley, and I suspect that a lot of you who are watching this video already know that I'm Dr. Hartley, but sometimes I have to remind myself, so that's what we're doing. I'm here to talk more about the nuts and bolts part of this. What you can do. Yeah, don't do that, okay? Hand washing is probably the most important thing that you can do, and it sounds like such a stupid little thing, but it's really, really important that you keep your hands clean and that you use proper hand washing technique, which medical experts will tell you should be at least 20 seconds, and you need to involve all the surfaces of your hands, not just the front, the back, in between the fingers. Don't touch the faucet after you've washed your hands. Just little things like that. And you know, for a long time in medicine, in nursing particularly, I was a nurse before I was a doctor, we would tell people to sing happy birthday, because it takes about 20 seconds to sing happy birthday. But I want you all to practice this instead, because it's much better. As you wash your hands, I want you to say, "These are the voyages of the Starship Enterprise, our 5-year mission to explore new worlds, to discover new civilizations, to boldly go where no one has gone before." If you do that, your hands will be clean and you will never get the COVID virus, I promise. Social distancing sounds like a really nobody really knows what that is, but basically, when you cough or sneeze, you project droplets of, for use of a better word, snot, about 6 feet into the air. That's why we came up with this figure of stay 6 feet away. So if you sneeze or cough, or another person does, those droplets will not reach you, because those droplets have live virus in them. And the virus can stay alive on particularly hard, smooth surfaces for days. We don't exactly know how many days. So just clean hands, stay away from people, Don't go places that you don't have to go. Think about what you're touching when you're outside. For example, you can't go into the bank anymore. You have to go through the day-night teller, the ATM, or you have to go through the drive-in. If you go to the ATM, either take a hand wipe with you and wipe off all those buttons before you touch them and after you touch them. Or take a tissue or something to create a barrier between your finger and those buttons, because you don't know what could be on them. Just little things like that. Coughing. Everybody coughs. It doesn't mean we have the COVID virus, but it might. So if you're going to cough, if you have to cough, and it's a reflex, you can't stop it. Don't cough into your hand, cough into your elbow. That's the best way to stop the droplets as much as possible and to contain whatever you're coughing into a surface that is unlikely to touch something else. And I want to talk a little bit about the concept. You see it on Facebook, you see it in the news, the concept of flattening the curve. What we're talking about is if we're not using any of these measures, hand washing, not touching our faces, not going where we shouldn't, where we don't absolutely have to go, staying away from people, that allows the virus to spread rapidly. It's spreading in some parts of the country now, particularly in New York, exponentially. If you look at a curve of where they started from 0 cases to the 30,000 cases they have in New York State now, it's an almost vertical line. It's a very steep curve. So what's happening is a lot of people are getting sick all at one time, and those of them that are sick enough to need to be in the hospital are a problem for the healthcare system, because there's a limited number of hospital beds, there's a limited number of ICU beds, there's a limited number of ventilator machines, there's a limited quantity of nurses and doctors and respiratory therapists. So we know that we can't stop this virus. It's too late for that. And it was probably, truth to tell, it was probably always too late to stop it completely. But if we can slow down transmission, so instead of those 30,000 cases being up here on a vertical line, they are spread out over days to weeks, then we can accommodate the people that are sick enough to need to be in a hospital and take adequate care of them so that as many of them as possible survive. And this is a big deal. You know, I hear people say, oh, well, more people die from the flu. And it's true. Between 20,000 and maybe 60,000 people a year in the United States die of influenza. But the death rate of all of the people in the country that get influenza, only about 0.1% of them will die from it. People don't get very sick when they have it. Some people are immune to it because they've had it before, or they had a vaccine. No one in the world is immune to COVID because it's not a human virus. It came from animals and it jumped species to humans. So no one's been exposed to it before. Everyone that comes in contact with it is at risk of becoming extremely ill. So far, most of the deaths have been either elderly people or people with pre-existing conditions, but not all of them. About 20% of people in the ICUs with COVID are healthy young people that had nothing wrong with them before. So you can't take for granted. That's why these measures are so important, why it's so important to slow down the transmission of the virus. And I think here in Benson, so far, we're doing a pretty good job. Most of the businesses in town are voluntarily complying with utilizing drive-throughs and takeouts and limiting the number of people that can come into the business. And that's absolutely wonderful that they're doing it voluntarily. At the hospital, we're trying really hard to follow these same measures ourselves by using masks, by checking people before they come into the building, by limiting, well, at this point we're not allowing visitors at all, and trying to keep our patients as healthy as we can and trying to keep our staff as healthy as we can, because if we lose our healthcare, we're going. about utilization of healthcare. You know, if you get up in the morning and you have a little bit of a runny nose and you have a little bit of a cough, could it be allergies? Are you catching a cold? And in the back of everyone's mind is, what if I have COVID? And should I go somewhere? Should I call someone? And at this point, what I would say to people is, number one, if you feel that you are sick enough to need to be seen in person by a doctor today, come to the emergency room. That is what we are there for. We will never turn you away. But we also don't want to see a lot of people coming in who really aren't that sick or are just worried about what might happen, because that's going to overload our healthcare system and perhaps unnecessarily spread disease to people who are healthy. So if you get up and you have mild symptoms, you have maybe a little scratchy throat, maybe a little runny nose, you're not running a fever, you don't really feel sick, call your primary care doc. Most of the primary care docs in Benson now are going to either all phone and video appointments, or at least partly. But they can answer your questions, they can ask you the appropriate questions to help you decide, do you need to go to the emergency room or not? So they're going to be your first resource. And all of them are in our loop with the hospital and with the county and the state about all the newest recommendations. They know the answers as well as we do at the hospital. But if you wake up and you're feeling short of breath, you ache all over, you have a fever, you're coughing, come into the emergency room and let us take a look at you, let us help you. That's about all I have to say.
I truly believe that if something happens, we have a hospital that's prepared for a situation that's getting ready to come up. I truly, again, want to say thank you for taking your time out to come visit us today and giving us the information we need. And to the city of Benson and surrounding areas, again, I just want to say thank you for joining us. As I always say, what we know, you will know. Always be safe, take care, and be kind. And I hope you join in to us tomorrow on our next.